I was spending a lot of time with people. I was putting a lot of effort and energy into figuring out what was going on. And I was getting pretty good results, right? I was being a diligent practitioner, but it always felt like something was missing. And so once starting this work, we just noticed it was just completely different. This is like a full system, and we're really getting people better that no one else is getting better. Jennifer Greco, Buffalo, New York. I practiced chiropractic for 13 years before starting the adhesion release. I think that people were getting some relief with the chiro, but it was kind of not as encompassing as now. So the outcomes are better with adhesion. People are getting out of pain and not just kind of having a band-aid to the pain. We're actually having some long-term changes in the patient's health. I was spending a lot of time with people. I was putting a lot of effort and energy into figuring out what was going on, and I was getting pretty good results, right? I was being a diligent practitioner, but it always felt like something was missing, like we couldn't fully turn the corner, or I was getting lumped in with everybody else, and I felt like I was trying to go above and beyond, but not always having all the tools that I needed to get there. And so once starting this work, we just noticed it was just completely different. Challenged your mindset, challenged your ability to really diagnose and solve the problem. This is like a full system, and we're really getting people better that no one else is getting better. I've been a cash practice from the moment I started. So I never took insurance. This was a good segue because a lot of times commodity doctors are taking insurance, and I wasn't. I was spending a lot of time chasing problems. So I would spend 30 minutes with every patient. We would throw everything but the kitchen sink at them. They would get better. I wasn't always sure what was working, what wasn't working, because we would just be treating so much. So now we've shortened the visits because we're better at finding what's going on. So the visits are now 20 minutes. I'm now able to see another person per hour, so I'm able to help more people, and we're able to charge because of all the training and because of the confidence with the training. I can confidently say that increasing the rate was no issue. Maybe issues like, oh, should we do this? Like, should we increase the rate? But there was no issue in terms of the quality that we were providing was above and beyond what I feel like other doctors or commodity doctors are providing. And the patients didn't bat an eye at it because they feel like they're getting what they're paying for, I guess, and we're charging what we're worth in terms of the training that we've done for that. The practice has grown quite a bit. I think I never really was focused. So for me, and we all say this, but like I was always focused on being the best I could be and knowing that, the money would come. People are a little uncomfortable talking about money. The money would come if I was doing a good job. But that is true. But if you're not valuing yourself for the job that you're doing, you may not be charging appropriately. And I think because of the results, because of all the time and practice put into it, this increase of income has changed everything. I mean, the practice is giving us a better life. Like you think, oh, I went to chiropractic school, so now this is just what chiropractors make. This is just where we're settled to do. And it's not. And you can actually really be paid what it's worth with all the work that you've put in, and not just settle for being like, I'm coming out of school, they'll be like, oh, you're not a real doctor, you're not doing this, or you're not doing that, or you're not paid effectively. And it's like, I think one of the best things, and it really resonated with me since doing this work, is I have a friend who's a surgeon, and she says, well, other people don't understand because we heal people with our hands. And they feel like we should be valued in that way. So I think we just have to value ourselves in that way, right? So it's changed, our whole life, my family, now it's just like, okay, I can see where this is going, and it's not just gonna be a to get by kind of thing. I think anything that changes your whole perspective on life is worth a 6-hour drive, right? Able to help people, able to earn an income that I wanted to earn. Had more people get better than I've had in, practicing this last 13 years. So in a year, I changed my entire practice. I changed my entire model. I did things that made me very uncomfortable, and without the support and encouragement to go and do that, and like what's the next step, so when are you implementing that, has changed everything. So it's kind of an invaluable thing. Forced me to be what I knew I could be but wasn't necessarily doing. I think that without this, a lot of people are going to be in pain still. So I think Dr. Chris is doing an amazing thing in keeping this treatment accessible. And I think that if people just give themselves the time and the space to do it, it's going to take shorter than you think, but also longer than you think in a way. So like, yeah, I think he's awesome. I mean, changed my life.
If you want to learn more about chronic pain relief and adhesion release methods, hit the like, hit the subscribe, stay tuned every Tuesday and Friday for new videos coming right to you, and I can't wait to connect with you.